Good day, everyone. My name is JJ. I'm a physical therapist who had a stroke. Today, I'm going to talk about one of the common complications after a stroke, falls. Like what I said, I had been practicing physical therapy for more than 20 years and I had worked with many stroke patients in different kinds of settings, from hospitals, skilled nursing units, outpatients, and a few times in home health. Through the years, I had observed that it's very common for stroke patients to have an injury on the affected side or fall. Even amputations on the affected side, I've seen where they develop a wound that will not heal on the affected side. If possible, try to avoid those complications by preventing a fall. I'm gonna show you some of the techniques and precautions that I have done to prevent me from falling when I had my stroke. Well, I'm still experiencing the effects of the stroke, as what you can hear in my speech and with the way I move. Okay, camera lady, you can follow me. One of the most common areas for people to fall following discharge from the hospital or a rehabilitation center is when they go home, is when they fall in the bathroom. I'm going to show you how my bathroom is set up to prevent me from falling. You can follow me using my left hand. Let's go to the bathroom. It's important that the floor is uncluttered. This thing is a risk factor for falling. To the floor. It's important that the bathroom is accessible and the light switch are easy to reach, or you can have a motion sensor detector light. Whoever comes close, the light turns on automatically. It will help save the stroke patient from reaching or doing anything else, prevent them from falling. And that's what you can see in the bathroom. The setup is the toilet has some support here. You can use a 3-in-1 commode. This was set up by my fiance to prevent me from falling. And the other one is in the shower. It's better to have a shower chair and a shower handle so that the patient can have their shower sitting up. They don't have to be standing. In that way, that decreases the risk of falling. And the other thing that seems to be very useful is this thing, again set up by my fiance. You just have to tighten this bar. She ordered this from Amazon. What's the name of this thing?
Top grab bar.
Top grab bar. Pretty useful, pretty helpful, but it can only support a certain amount. You don't really have to rely this thing to pull your whole body weight. In my case, my right leg is strong enough and I have some strength in my left leg in such a way that I don't put my whole body weight. I can just ease myself down without unnecessarily bearing all of my weight on here. The other thing important to remember is the towel rack is not a grab bar. It's only flimsily installed on the wall and it does not support a person's full body weight. Don't pull on it hard. In my case, my right leg is strong enough. I can even hold it without pulling all my body weight. but I'm able to stand. One of the techniques that I used when I was in the hospital, whenever I need to use the bathroom, is I stand close to the toilet and put my right leg in contact with the toilet. It gives me a feedback about my balance, since my balance is strong enough. When I need to do number one, I could do this, and nurses were amazed how I was able to maintain my balance without falling. Now, in my case, my right leg was strong enough and my balance was still intact, but I don't recommend that to somebody who can't stand at all. If the safest way to use the toilet is by sitting, when you're doing number one or number two, like this, that's the safest way. One of the common problems associated with if you're a man, which nobody talks in the books, is that if you're a man, if you're not sitting, if you're not positioning correctly your hose, I will just use the term hose because there might be some kids watching this video, is that when you're sitting, just right sitting, and if you need to pee, instead of peeing into the toilet, it will end up into your underwear or shorts. Not good. And when you do number two, or after you get done, one of the people usually want to clean themselves up. This is where people usually fall. When they stand, reach for the toilet paper, like that. If your balance is not good, just by reaching forward or turning your head, it shifts the weight, the center of gravity. And if you don't have a good balance, person can easily fall. In the hospital, whenever you get done using the bathroom, they always emphasize to pull the string or use the call light so that the assistants or the nurse can help you. At home, there's nobody like that. And sometimes the other family members are asleep, and or you don't want to trouble anyone from helping, or you're too embarrassed to have other family members to help you. So that's why for some patients, especially if they have a right hemispheric stroke where the adjustment is affected like mine, you feel like in your mind everything is fine and you can do it, which I usually does anyway, and I did it. So most patients, they will stand, cut the toilet paper. You can cut the toilet paper with one hand like that, and they try to clean themselves up. When they turn like that, a little shift like that, that's when usually patients fall. And if the left side is weak, unlike when you're doing some role playing when you're in school, where you pretend this side is weak, it's different when you actually have a stroke, because this side is slim and heavy. There's no power at all. When you lose your balance, you just go right away. No warning. Before you realize it, you fall already. So the safest way to clean yourself is, the best way is to using your good side. In my case, my right hand. You reach behind and clean yourself up like that. Now, some of the useful things for some patients is having these wipes. This one is Equate. You can buy this at regular store, pharmacy stores like Walgreens or CVS, even Walmart. Wipes. It can help you. They are flushable and supposed to be hypoallergenic. Not only that, it gives you a good scent. Yeah, it helps. Like what I say, at home, there's no cold light to use. It's important that you do not fall, because the danger of falling is that you can complicate your condition. You can have a broken bone or worse, hit your head against the edge of the tub, which is notorious for hitting people in the head. And for the shower, it's better to have a handheld shower and have a shower while you're sitting instead of standing. Before my stroke, I could do showers in standing all the time with eyes closed. Now I'm aware that my foot can slip and fall and have a serious injury. So I just sit on the toilet. Now I regain some of my strength. I could do some showers in standing, but I'm still careful. And I can now lift my left leg in and out of the tub. But the safest way to use the shower chair is by going to the shower chair, getting close to it, and sitting on it. I'm using the towel grab bar and lifting my leg one at a time into the tub. That's the safest way. I think that's all for now, everyone. Thank you for watching. I hope you learned something.